This is the Amy Edwards Show, and we're here to make life the best it can be at every age. Let's do this.
If you've got active cavities that you're ignoring in yourself and you're like, I just want to focus on the kiddos, then we're still going to have that bacteria that just runs in the family. Like the family needs a reset. The whole family. It's a family illness, tooth decay is. It's not just a one-person thing or a one-tooth thing. It's an illness, it's an infection that the family has. And so if we can treat it together and treat it as a family, which is what we try to do in our practice, then you can really change the trajectory of that family tree. And so that's really what I want for my families is I want to take those families who say, oh, we just have bad teeth, or little Johnny just has bad teeth. And we want to be able to change that narrative to say, okay, we are a family with healthy teeth and we have the tools that we need to make that happen and to keep it that way.
Hello and welcome to the show. You guys, I am so pumped about this one today. I know I say that a lot, but this is something that has been on my mind. And when I saw this come in my inbox, I was like, this is just an immediate yes. I cannot wait to talk about this. So today we're talking about, well, let me get into it. Let me introduce our guest first. Her name is Dr. Toni Engram, and she is a SMART certified biological dentist. She's an integrative health coach and the founder of Flourish Dental Boutique, which is a truly holistic dental practice that redefines the way that we think about oral health. She's someone who has healed her own Crohn's disease and stepped away from the conventional model of dentistry. And Dr. Toni is on a mission to bring whole body wellness into the dental chair. Through her work, she's helping patients reconnect oral health with systemic health using biocompatible materials, airway conscious care, and a radically empowering approach to prevention. She's also a powerful educator and content creator, guiding families, parents, and practitioners toward toxin-free and informed choices without fear. And Toni, I am so stoked that you're here today, so welcome.
Thank you. That's the best intro I think I've gotten.
Oh, well, thank you so much. I'm so glad. Part of the reason I'm so enthusiastic about this is number one, my mother had ulcerative colitis, which is very much like Crohn's.
Yes.
And I remember her mentioning, she has since passed, this was in the 90s, but I remember her mentioning the connection with oral health and how careful she was about that. And it just piqued my curiosity. And then cut to years later, now last fall, I interviewed a functional nutritionist, Risa Grew, and I'll put a link in the show notes if anybody wants to listen, because she had an oral issue and it was connected to her thyroid. And she blew my mind with her story. So then I was having lunch with a friend and I was telling her about it, and she's been having root canals and all these things, and she has thyroid issues. And she started telling me how different teeth are connected to different parts of your body, or that's, something that people talk about. And I looked it up and I was just fascinated by all the different teeth and the connection to our body. And and then here we are. And so this has just been something that's been top of mind, fascinating to me. And I love what you do. And I think it's just so incredibly important. And dentistry is one of these fields where they're really treating the symptom so many times and not a root cause. And so I'm so excited to talk to you, but why don't we just get really basic with it at first and say, what is biological dentistry and why should everybody be rethinking their own dental care?
Yeah. So a biological dentist, I'm going to start just super high level. And then we'll get down into the nitty gritty, like what does that actually mean, Toni? So just high level, it comes from the concept of biological medicine. And the concept is that we're going beyond the germ theory of disease. Germ theory just says one germ causes one illness, so therefore one chemical can then help one illness. And we're really looking more at the terrain theory of disease. So how do we support the biological terrain? How do we have a healthy body? And in dentistry, that means how do we have a healthy mouth that supports the health of a body and vice versa? How do we make sure that we're contributing to a patient's overall health and not adding anything that could contribute to illness? So what the heck does that mean, guys? It means that we're focusing a lot on nutrition and prevention. We're trying really hard not to have to drill on your teeth. Often less dentistry is the best dentistry. And
I
when
love
we
this so
do,
I love this so much too. I get like fearful at the dentist. I'm one of these people. It's like,
so
stop,
many people does. Yeah, do.
Ugh.
Yeah, yeah. And then when we do need to do some work, when we need to intervene, we're very, very intentional with the products and the materials that we use and the ingredients. You're trying to minimize toxins, do things that are as healthy and as natural as possible. Um, in like the just practical, what does that look like in your normal dental appointment? So most of us, for sure for myself, I don't have fluoride anywhere in the practice, not even in the water. We filter it out as soon as it comes in. So no fluoride because the risk is more than the benefit, in my opinion, and we can talk about that in a little bit later. Those old silver fillings, we for sure don't use them, but most people in the States don't use them anymore. But when we need to remove them, we're very, very intentional and have specific protocols for how we remove them. Again, we want to minimize toxic exposure and minimize mercury vapor that you're exposed to in the dental chair. We're looking for hidden infections. We're talking all about nutrition. We're looking at your airway. It's very much a whole body approach to oral health.
Okay, when you were in school, did you already do this? Like, was this your focus from dental school, or is this like you had to learn extra? What was that learning process like for you? Or, I don't know when your Crohn's journey was either.
So Crohn's was after graduation. I was diagnosed in 2011. I had symptoms in dental school. I just didn't know what they were.
Mm-hmm.
I graduated in 2008.
Okay.
So in dental school, no, it was very much, I mean, gosh, I'm not that old. I graduated dental school in '08, but I'm old enough that, and I don't know what the narrative is around it now, but definitely the narrative when I was in school was that, hey, those holistic people that take out silver fillings, that those guys are quacks. Don't listen to those. They're just scam artists.
Wow.
There was nothing good said about biological dentistry at all. And still, there's still blowback. I had some dentist reach out to me on Instagram who was just like super snotty and said something like, I believe in evidence-based dentistry. Uh,
Wow.
as if what I believe is not evidence.
Yeah. Yeah. I suspected that was kind of going to be the answer. This old school model is so hard to break, especially in these medical fields. Like, the more I hear about it, but everything's connected, and your terrain theory it just makes sense. The more we learn, the more we realize that like everything is connected.
Absolutely. Absolutely. And Eastern medicine has known this for a really long time.
Mm-hmm.
And finally, Western medicine is trying hard to catch up just a little bit. So in Eastern medicine, you've got the meridians, and there's a whole tooth meridian chart that connects individual teeth to different organs and organ systems. So just a ton of connection that they've known about for millennia. But even in Western medicine now, there are more and more studies connecting oral health issues with systemic health issues. So if you've got a mouth that's out of balance, you're at a higher risk for things like heart attack and stroke, Alzheimer's, dementia, all kinds of autoimmune illnesses, pregnancy complications, fertility issues. The list goes on and on and on. And so I'm so excited that we finally have an appreciation of the connection, after our predecessors made the mistake of separating mouth health from overall health 150 years ago or whenever that was.
It's such a trip. I think the tooth meridian chart is what I was looking at when I started researching this a few months ago, because I hadn't even heard of that. Here we are. in my 50s, I haven't heard of that. That's crazy, right? And do you find like that to be accurate, that different teeth can affect different organs?
It, it's, I find it very, there are a lot of like weird, eerie things where you're like, oh, I
Yeah.
hadn't thought about that. And so I'll pull it out if something clinical doesn't make sense. Like if something on an x-ray is weird and wonky, but it doesn't really line up with the symptoms that we're seeing. And so we'll just say, hey, is there anything going on with your gut or with your lungs? And a lot of times they'll say, oh, now that you mention it, yeah. Or like I had
Wow.
a patient who had some pain in her gums that was baffling me. It didn't make any sense clinically. Her measurements were fine. Her x-rays were fine. She's like, no, I feel something. And, we do laser treatments and it would always make her feel better. Well, turns out she had cysts on her ovaries. And where she was feeling the pain were on the lower anterior teeth that are connected along the same meridian to the urinary system.
Wow. That is so wild.
Isn't
That
that
is
wild?
so wild.
And then once she had the
Yeah.
cysts in her ovaries removed, she didn't have the gum pain anymore.
Oh my God. That's so cool. Like,
Right?
and I think that we just kind of discount mouth pain. I mean, I know I do. I don't really pay as much attention. So,
Yeah.
when you had Crohn's, did you notice, like, tell me what you noticed in your oral health?
Nothing because I didn't know any better.
Oh,
I didn't notice anything in my oral health. I thought I was trucking along just fine. Um, but what's funny is that the more I found out, um, I was going down all these rabbit holes online trying to discount what my doctor said. My doctor said, you're going to be on these medications for forever. And oh, by the way, sorry about your luck. You might need surgery at some point to remove part of your colon. So I did not accept that answer, not because I was holistically minded or integrative in any way at the time, but because I was just stubborn and I didn't believe him. So it was me like going down, becoming my own doctor, figuring out what made sense scientifically, what made sense for me and my body. And the more I learned, the more I realized, what I treat in the mouth every day is basically the same thing. So Crohn's disease, it's an autoimmune condition, but it is an inflammatory condition, really, caused in part by a dysbiosis in the gut, so an imbalance in the gut bacteria. Uh, Tooth decay, gum disease, it's all about inflammation and a dysbiosis in the very first part of your gut, which is your mouth, right? And so it was seeing that, these are really one and the same. And then figuring out how to get myself well and treating my own Crohn's disease, healing from Crohn's disease. I realized, man, if I can figure this out for myself, then I can and I have to figure this out for my patients too. I've got to help them be able to get well from the chronic illness that I can treat along with them. Um, and so now that I'm more aware of those connections, you better believe I will notice if my gums are a little more inflamed, if I have a sore pop up in my mouth here and there, that I'm paying attention to what's also going on in my gut. Have I been slacking on my nutrition lately?
mm-hmm.
Have I been not resting as much as I need to rest lately? Like, what is actually going on with my entire body that may be showing up in my gut or may be showing up in my mouth, but I need to listen either way. And that's what I didn't know to do before. 2008 through 2011, a new graduate from dental school, I was type A overachiever. It was ignore any symptoms you're having. You got to push, push, push. And so thankfully, I've hopefully outgrown that to some extent.
It's so fascinating. That was the story that I was referring to of the functional nutritionist that I interviewed last fall. She had a gut test and found a weird salivary bacteria in there, and that's why they went to her mouth. And ended up she had a piece of metal left in when she had her wisdom teeth removed 17 years earlier, and a little bit of some sort of root or something. And once they got that out, things started to heal. And it just reinforces that it's so wild, right?
Yeah.
But like you, it led her down this path of like, oh my gosh, there's so much more to this and I can help people. And she ended up doing what she does. But that's kind of this thing that's made me think, and I got my gut tested and all that. But I think, we think about it as our second brain already, but I don't think that even though we're like, of course they're connected, we're not as focused on it as we could be when there's so much to be learned about our own health. Such a trip. Yeah, such a trip. Well, so what happened with you?
So you mean what
like
happened?
With the Crohn's, like what started how did you start to change things?
Well, it took a while to get diagnosed. Like I said, in dental school and in my first pregnancy, I was having symptoms and just ignored them. Just went all along about my day. But by 2011, it all came crashing down because I was working full time. I had a toddler at this point, so I was doing the first time mom thing. I was opening my first practice from scratch, startup practice. And I was working in a part of town where there weren't a whole lot of great food choices. And I was not making great food choices. I was just eating super fast junk food on the run. And so I started having just GI issues day after day after day, was in the bathroom multiple times a day. And for the first few months, I finally went to a gastroenterologist. He's like, it's probably just IBS. Take some peppermint oil and let me know in a few months if it's not better. And it wasn't better. It kept getting worse. And then I started losing weight. And then I started like having bloody stools. Sorry, TMI. But that got my attention because I at least remembered enough from school to know.
Yeah, for sure.
That's not a good thing. That you should pay attention. And so the doctor then was like, all right, let's take a look under the hood. So I scheduled a colonoscopy and surprised the doctor. He's like, I'm quite taken aback. You actually have some pretty significant damage here. And, told me all of my options, gave me the death sentence.
Mm-hmm.
Not death sentence, but that's kind of what it felt like.
No, I mean, I know enough from my mom, like, in fact, she got it older, ulcerative colitis, and she ended up getting tumors and passing away. But
they don't give you much hope.
No.
They don't give you much hope.
Yeah.
Which again, it's like I was just too stubborn to accept that.
Good for you.
And so I asked all the questions that I knew to ask at the time. I was like, well, how do I get rid of this? What do I need to eat or not eat? And bless his heart, this guy looked at me and he's like, Toni, your diet has nothing to do with this. Literally. Like the gastrointestinal illness that's eating holes in my gut. You're telling me that my diet doesn't have anything to do with this?
How's that possible?
It's not.
Oh, okay, good. Okay, he's wrong. I'm like, wow. Well, then what was it?
It's not possible. So I went on the medications in the beginning because I was scared not to. I wanted to stop it. So I went on the medications at first, and that got me feeling better quickly. It put me in remission really quickly, which I'm super, super grateful for. Because then I had enough bandwidth, like I felt good enough that I could start doing the research and I could start looking things up. I didn't know about functional medicine at the time, so I was just like piecemealing everything together, changing my diet, changing my stress level, and how I ate was really important for me, because I think for me a lot of it was stress related. Like I was too busy to sit and digest my food.
Wow. What'd you go from in your diet to in your diet? I'm just curious.
I did an elimination diet.
Mm-hmm.
So I started out with, very, very minimal food choices. It was, chicken, beef, some cooked vegetables, and that was about it. And then started adding things back in little by little and felt better. Was still like I added foods back in on a pretty regular clip and still felt better. And then, the better I felt, the braver I got. But again, I was still on the medicine. I was on the medication for a little over a year. And it was my second pregnancy where I really wanted to get off the meds. I'd felt good for a year. I felt like I was doing what I needed to do. My GI doc was like, don't get off the meds. Don't do it. You're going to have a flare up and then it's going to be a hot mess while you're pregnant. And it was my OB. None of these people were integrative at all, by the way, but I had a good OB who listened to his patient. And it was important to me to get off the medications because it was like a category C, or like I knew it would be excreted in breast milk, one of the medications that I was on. And so I told him I really wanted to get off of it, in time for it to clear my system before I started breastfeeding. And he's like, okay, well, here's the risk. Here's the benefit. If you want to do this, here's our game plan. And here's the worst case scenario if stuff goes wrong. And so he gave me all the information like a good practitioner should do. And then I made the decision, got off the medication, felt no different, still felt great, and never looked back. I've never had a flare where I needed medication since then. And that was 2012.
Oh my gosh, I'm so happy for you. That's so incredible.
It was, and I realized that I am more fortunate than many, because it's not always. I feel like it wasn't easy, but it was so much easier than so many people have it. I'm still, now that things have healed and I'm paying attention for the most part, I can pretty much eat what I want. And I haven't had to have surgery and I haven't had to go back on any medication. And not everybody is that lucky. I know people who have done all of these things, and they still have terrible flare-ups, or they catch it way later than I did and still have a harder time getting over it. So I was very, very fortunate. And I really think that God just used that as like, here's the direction that I need you to go, Toni. Look this way. Look this way.
Yeah.
And so
absolutely.
It changed my career so drastically. So drastically. Even though it wasn't a dental issue that I had, it saved my career, really, because doing like the normal drill, fill, and build dentistry was not rewarding to me at all. I just didn't enjoy it. So I'm confident that I would not still be a dentist. I don't know what I would have got into. Maybe I'd do real estate or something, or I'd become a nutritionist, maybe. I'd be doing something else besides dentistry. But this was like, no, maybe you can actually change dentistry a little bit or change people's view of their oral health a little bit.
So what's it like when someone comes to you? What's new? How do you do it different?
So we have a pretty long, comprehensive first visit. So patients are with us for a couple of hours. We always do, well, we try to do, you can tell us no, but I like to do a 3D scans called a cone beam CT. So we can check for any of those hidden infections like you were talking about.
Yeah.
Look at those root canals in 3D, look at where the wisdom teeth were removed and make sure there's nothing hiding. Helps us see the size of the airway. I like to do some salivary testing. So we'll check the salivary pH. I like to do a really thorough saliva test that looks at over 700 different species of bacteria and candida and beneficial bugs and all that good stuff. And then we'll still do, if it if it makes sense, for most patients, we'll still clean their teeth because they're coming to us to clean their teeth. But even our cleanings, like all of our water is ozone water. So none of the water in our practice that touches your mouth does not have ozone in it. And then we do just a really thorough exam.
That is so cool. I'm sitting here kind of in disbelief, like, why hasn't a dentist thought about these things for me? Like, even just the x-ray part, I had to have that head thing done once
Mhm.
I had to have a sinuplasty once. And
Oh, yeah.
and it was just so cool, like, to be able to see your head moving all around.
Yeah. Yeah.
And but you mentioned airways too. Is that something that you focus on, like how people are breathing, how they're breathing at night? Because I've read that book Breath by James Nestor, which is
Isn't that such a great book?
it's super fascinating about mouth breathing and nasal breathing. Do you work
Yes.
on that with people?
Yeah, absolutely.
Ah,
So we're
yes.
screening for it, first of all, and I think because we can visually see it on the cone beam CT, we're in such a better position to talk to patients about airway issues than their primary care doctor because we're actually seeing it. And we're seeing a lot of the signs and symptoms that maybe patients aren't noticing. Like
Like what?
I can look at somebody's mouth and if you've got flattened off molars, you've got a ton of grinding and clenching wear, or if it looks like you've got, signs of silent reflux, a tongue that looks like it's too large for the mouth or scalloped borders of the tongue, all of these things can be indications that there are some airway issues, whether that's sleep apnea or airway resistance or whatever the case may be. We need to take a deeper look. And so being able to see that for patients and help guide them in that direction can be such a game changer, especially if people just aren't feeling good and they don't really know why they're not feeling good.
Oh, big time. And especially for, do you help children? I mean, you've got your own
Mhm.
children, so you must like make sure that they're breathing properly and everything for their own oral development because those are so tied
Yes.
up together.
The youngest I've seen is 2 days old
What?
with a newborn, with an infant tongue tie release, because those tongue ties can be.
What is that? I don't know what that is.
So you have the little string of tissue often underneath your tongue called your lingual frenum, and if that is too tight, then it can impact breastfeeding. It can also impact growth and development. And so it can be
Wow.
just the starting point of this whole cascade of symptoms that happen down the road that if we can catch it in a newborn, we can really change that kiddo's trajectory by giving them a chance to breastfeed normally, have a breastfeeding relationship that's less painful for mom because sometimes it's really
Mhm.
painful if you've got a tongue-tied baby. It helps the growth and development, not just of their jaws, but of their airway, because your tongue should be able to lift up and rest at the roof of your mouth. And if it can't do that, then you're going to have this whole, cycle of issues of open mouth breathing at night, which then leads to a smaller, narrower airway, more allergies, more tonsil inflammation, just the list goes on and on. And so the best case scenario is if we can catch baby when they're super, super new and make some of these tiny little corrections then it sets them up hopefully for a much better lifetime of success.
A life, but much better life,
Yeah.
period, right? That is ultra fascinating. And I mean, I'm just sitting here kind of with my mind blown, like, why isn't this stuff? Like, did you discuss any of that in dental school? Airways?
No.
Like,
No.
doesn't that
Uh,
seem
it's
weird?
not only that, but both of my kiddos were tongue-tied, and I had a terribly painful time breastfeeding my first one, and I didn't know anything, and there was nobody gave me any help. Again, I was just figuring this all out on my own. My poor first child, she's the experiment child,
Wow.
obviously.
Yeah, yeah.
Um, but yeah, it was
Wow.
such a horrible experience, so that once I learned about it, um, again, learning about this whole world of midwives and doulas and people who knew a whole lot more about newborn anatomy than I did, even oral anatomy than I did,
Hmm.
and being able to learn from them how it can impact newborns, and then adding the dental piece. Oh, not only does it impact them as newborns, but it impacts their entire life. Um, it's it's been such a fun area of practice and a fun way to be able to help families.
I mean, it's just that's incredible and like just so eye-opening. How do you even get that diagnosed right off the bat? Does the doctor look at your baby and tell you, or do we just not know?
It sometimes you just don't know. Hopefully, you have a good doc. Usually, it's not the doctor that's seeing it. Usually, now
Wow.
I could be wrong. And a lot of time, it's still like a weird area of contention between pediatricians and dentists. Um, Pediatricians think that it's kind of overkill, and there are some. I don't. I don't know of any dentists who think it's overkill. I don't think that every baby needs a tongue tie release, but there are a lot, and I think
Wow.
it's more impactful than we've appreciated in the past.
That is so cool. All right, you mentioned a saliva test. I've never done a saliva test. What do you learn from that when people get it?
So there are several out on the market now that have been available to dentists for a while. My favorite one is a newer company that they test for over 700 different species that can inhabit the saliva in your mouth. And so we want to see, are there enough of the beneficial bacteria in your mouth? Is there an overgrowth of candida? Do we have too many of some of the scarier bugs? Like, there are some pathogenic bacteria that are more strongly associated not just with gum disease, but they're associated with some of these other health issues like heart attack and stroke and pregnancy issues and autoimmune conditions. And so if those are present, especially if they're in higher numbers, then it really can guide how we treat our patients when the clinical signs, may just give us, oh, it's just a patient with gum disease, so we treat them with XYZ protocols. No, it really lets us be way more specific, and it helps us tailor what they do at home too. So sometimes it makes sense to put patients on a mouthwash for very specific period of time to now we're not doing like big name brand mouthwashes. I don't like the alcohol-based ones. Most of them are too strong and they're overkill. But we can be really strategic with some. And sometimes that's not what's needed. Sometimes all that's needed is an oral probiotic, or to supplement with some xylitol products just to kind of nudge things back into balance. But we don't know that unless we test and see what all is there and see what all is going on in the microbiome. But yeah, it's
Cool.
super, super fun to look at.
Oh, I'm fascinated. So into it. What does xylitol do?
Genuine. Mhm. Xylitol is a really cool tool that we have in our toolbox. I've been using it for years and years. It's just a plant-based sweetener. It's a sugar alcohol. It can come from two different sources. A lot of what you'll find is corn-based, derived from corn. But you can find more like safer, more natural brands where they get the xylitol from birch trees. So they isolate the xylitol, and it is close enough in structure to sugar that the bacteria that cause cavities, and lots of different pathogenic bacteria, they'll ingest it thinking that it's sugar, but they can't metabolize it and use it. So they'll just start dying off and kind of slip right off the teeth. So it helps reduce the biofilm on the teeth. What's interesting is it also helps reduce the
Wow.
biofilm in your sinuses and in your nasal passages. So if you use a xylitol nasal spray, it can decrease your child's risk of ear infections. And in the mouth, when you use it, if you use it in toothpaste or gums, mints, and candies, if you're using it enough, it can be as effective, if not more effective, than fluoride at reducing the risk of cavities.
Wow.
So it's
Does it matter? Does it matter which one I use? Do I need to find the healthier birch version, or does it
I
matter?
like the cleaner versions just
Yeah.
because I prefer not to use if it's derived from corn, it's probably GMO here in the States.
Yeah. Yeah.
So I prefer the birch-based ones, but and they'll
Wow.
usually say on the label if they are. But yeah, it works in the mouth. It kind of has two different mechanisms, two different ways that it works. So if you chew it or have a spray or whatever it is in your mouth, then it will increase the pH of your saliva really quickly. So if you already have a lower than ideal pH, if your mouth is a little too acidic for whatever reason, or if you've just indulged in a snack or a treat that you maybe shouldn't have, then xylitol gum or any xylitol product will raise that pH really quickly. So it can help with the acid attack. Um, the second way that it works is that bacteria method that we talked about. So over time, because it's selecting for its being ingested by the bad bacteria, and over time you'll start to shift the microbiome in the right direction so that you rebalance things and get back to a better homeostasis with your microbiome.
And does it kill off the bugs that feed on sugar? Is that kind of
It
like
doesn't actively kill them, it just allows them to die.
a very fine line there between killing
Yes.
and allowing to die? So they run their course and then there's no more, I suppose. So, okay, since I brought up sugar, let's talk a little bit about that. And what do you advise your clients on that? How do you feel about sugar in your own life and diet and your kids and all that?
I mean, of course, it's terrible for you, but I'm also a realist. Like,
Yeah.
it's it is what it is. I have kids that are now 12 and 16. So I think when I decide that I'm going to get off all sugar, then I can do it for a period of time because I'm an adult and I can do hard things. Um, I think most human people, again, I said for a period of time. Did you
Yeah.
notice that?
Yeah.
I have patients who said that they say they've been off sugar for years and years, and I believe them. I believe them.
I bet you can see the results, probably. I
You can
mean,
see the results,
yeah.
100%. You can see the results. You see it in their gum tissue. You can see it in their face. And
You can
with
see it in
kids,
their face,
absolutely,
like
absolutely.
just
You
their
can
skin.
tell when, yes, yes, they just look brighter and healthier, less inflammation all over. So you can tell when somebody's living right.
Yeah.
Uh, with kids, it's so hard. I think that they're exposed to other human beings out in the world, that then I think for most real kids in America, they're going to eat things that we would rather them not eat, and they're going to
Hmm.
be exposed to things that we'd
Yeah.
rather them not be exposed to.
Yeah.
Um, so avoiding sugar, yes, I would love for my children to avoid sugar altogether. I know that that's not going to happen, and so I don't fight it. I just try to give them the tools that they need to be healthy, um, and to be active and to perform how they want to perform. So both
Hmm.
of them are in sports, and so we focus on, okay, what's going to help you perform your best at softball tonight? Is it going
Hmm.
to be the Gatorade? Is it going to be, the cookies, the goldfish, or is it going to be something with protein that'll keep you, satisfied for a little bit longer? Um, so I try to focus on adding things that will support what they want to do, and then normal good habits, rinsing afterwards, brushing, that sort of thing.
Smart. Yeah. Well, since we brought up cavities, I've heard way back when, I don't know where I heard this, that there was a genetic component to cavities that I don't know if that's true or not. And I wanted to ask you, and then just you have a node or you try not to drill. And I know that that's a cavity thing. I don't really understand how it all works. I think they drill around where the cavity is and then have to fill
Hmm.
it or something.
Hmm.
But like, how is there a way to, if you've got a cavity coming, like avoid getting a filling or like tell
Sometimes.
me about cavities.
Yeah, yeah. Um, okay, let's back up a little bit. Where do
Okay.
we start? Uh,
Genetic? Is there a
Genetic,
genetic
that's right.
component?
Um, somewhat. There's a small genetic component. Well, it's much stronger. And the reason why sometimes cavities run in a family
That's what I've
is,
heard or seen and stuff.
yes,
So,
which
yeah.
is really, really common. They do run in some families, but it's less about genetics and more about the transmissibility of the cavity causing bacteria. So
Whoa. Cool.
anybody that you live with, it's, I'm sure a lot of people know this, that when mom gives birth, then you are passing on the microbiome that you have, that mom has, to baby. Well,
Hmm.
it's the same thing after birth and into those first parts of life, and even beyond. That even blowing on food, sharing kisses, just living together, and then into the toddler years, everything that they pick up and put in their mouth, all of these things will transmit bacteria. And so the people that you live with, you will have a lot of overlap of their microbiome. And so that's why with cavities, just like anything else, I tell moms and dads, like, hey, you got to take care of yourself first in order to take care of your babies the way that you want to. Because if you've got active cavities that you're ignoring in yourself, and you're like, I just want to focus on the kiddos, um, then we're still going to have that bacteria that just runs in the family. Like, the family needs a reset. The whole
Wow.
family. It's a family illness. Tooth decay is. It's not just a one person thing or a one tooth thing. It's an illness, it's an infection that the family has. And so if we can treat it together and treat it as a family, which is what we try to do in our practice, then you can really change the trajectory of that family tree. And so that's really what I want for my families. Is I want to take those families who say, "Oh, we just have bad teeth," or little Johnny just has bad teeth. And we want to be able to change that narrative to say, okay, we are a family with healthy teeth, and we have the tools that we need to make that happen and to keep it that way.
That's totally interesting and fascinating. Wow. So, like, you can transmit it with your kids, like, just by taking a bite of something and then they take a bite?
Yeah. Yes. 100%.
Wow. When I was a teenager, my mother would, like, she would never drink after me and stuff. She was like, I don't know where you've been." But that's really a case for, like, not drinking after people and stuff, like,
Yes. And it's very helpful if someone has teenage girls,
I
and
that would be
you
me.
you
Yes.
guide them on, be careful who you kiss.
Yeah. Yeah. I was not careful. I'm surprised my teeth are as good as they are, although I have had quite a few cavities, but let's talk about this drilling thing. So say, like, you're starting to get a cavity. Is there a different route, like, rather than traditional?
If we can catch it soon enough, then yeah, absolutely. You can get those to remineralize. Um,
Okay, that's awesome. Like, how do you catch it early? Do you just pay attention to any pain? Like, what do you do? Or do you visit you and, like, you
it's
look or
man,
something?
I don't want people to be in pain, but I really wish that cavities were painful. They're not until they get super, super big, and then it's a much bigger issue to fix.
Yeah.
So so yeah, a lot of times, sometimes if they're on the surface, then you can see them if you know what you're looking for. But I think it's just, find a dentist that you trust, that you love, that you can go see, that you can partner with. Because if they can find these little tiny cavities that are still in the enamel, if they're still in the outer surface of the tooth, then you can get enamel to remineralize if it's given the right environment. So nutrition needs to be on point. Your gut health needs to be in a good place. Um, we need to be breathing through our nose and not our mouths to make sure that the microbiome is healthy, that you have enough saliva in there. And then we can use remineralizing ingredients, like ingredients in toothpaste, like xylitol, to help put the minerals back in and get the body to do what it needs to do on its own, and heal those spots, because absolutely they can heal and get better. And hopefully we don't ever have to drill on them. Sometimes we do, um,
Mhm.
but hopefully we can catch it early enough so that you don't.
Wow. Are you a proponent of mouth taping?
I kind of am. Yeah.
Yeah.
I love the concept because anytime you can retrain yourself to breathe through your nose instead of your mouth, you're going to have much better oral health, much better sleep too, but much better oral health.
Yeah.
I even had one of my hygienists even started mouth taping her 5-year-old. So
Wow.
you can do it on kids too. Like obviously you want to be careful. Um,
Yeah.
don't just tell your child, I'd love to tape your mouth shut.
Well, I don't know. There's if you can train them for that, I mean,
Don't tell them Dr. Engram told you to say that.
no, certainly not. We haven't even really gotten into immune system yet, and I'd love to talk about the connection that you see with oral health and your immune system.
Oh, so I see this a lot in my gum disease patients because gum disease, again, is highly, highly inflammatory. And when you're inflamed, then your immune system is constantly having to work to to basically maintain that level of inflammation. It's a tax on the immune system.
Wow.
Um, and so, especially with our gum disease patients, I'll tell people, you don't realize this now, but you're actually going to feel better once we get your gum disease treated. You didn't know you were feeling bad, but you're going to feel so much better when you get this treated that it's going to be noticeable for you. So, absolutely, any kind of dis-ease, dysbiosis, or inflammation in the mouth is going to be a tax on the immune system.
Hmm. Okay, I have more questions. And how about is vaping? What do you tell people about vaping?
Mm. It's a bummer because I had hopes at one point, like when vaping first started. And I was in at the time, I was in a working class town, and there was a small business owner who opened up a vape shop. And I was really hopeful because that family's idea for their small business was, hey, let's open a vape store so that people can stop smoking
Hmm.
and they'll use it as a way to stop. So I was all for it. I was like, this sounds great. Unfortunately, it just didn't happen. They just traded one habit for another habit. And the stuff in vaping is like even worse in some cases than all the toxins and junk that's in cigarettes. So unfortunately, it wasn't the way to get out of smoking. It is just another icky, weird, gross habit that is, it's still wreaking havoc on people's oral health too.
Like,
Still,
what's it doing? Is it causing inflammation? Is it
yeah,
affecting our teeth or salivary?
inflammation, and yeah, that will decrease salivary flow for a lot of people.
Mm.
Which is, you need lots of good healthy saliva to have healthy teeth. Um, and those are really the main things. Thankfully, in my practice, I don't have a ton of people that vape, at least not that I know
That
of,
tell you?
right? Not that tell me.
Yeah, you can probably see, though, a lot of things pretty quickly. Do you know things before people tell you a lot of times?
Yeah. Yeah.
Yeah, like what their diet's like or something like that?
I mean, obviously smoking, I know that really quickly.
Mhm.
Sleep apnea, we talked about that. Acid reflux, I can see that a lot of times before patients notice it.
Oh, wow.
Um, but well, in any kind of acid wear. So if people have a habit of sucking on lemons, I'll see that. If they get on an apple cider vinegar or a lemon water kick for a long period of time, I'll see that.
Wait, hold
Unfortunately,
on. Should we not do that? We shouldn't do those things.
you should just do it carefully. It's
Oh, very
highly,
interesting.
highly acidic, which is great for your overall system. It's alkalinizing in the body, but it's still a really strong acid on the teeth. And so it will etch away at your tooth enamel over time. So the patients that just really enjoy it, or their naturopath really wants them to do it, feels like it's important for them. If they got like liver issues that they're working through or something, and their providers really want them to do that, then we'll just do it more carefully. Then we'll make sure that they're rinsing with water afterwards, using some xylitol products afterwards. You definitely don't want to brush right after, because you don't want to brush after you've softened the enamel with acid. So we're just more careful with it, but you can still do it.
Wow. I interrupted you. I can't even remember what you were saying, but what other habits do you see that are like,
yeah. Habits.
yeah,
Bulimia.
yeah, for
I
sure.
see that. Um, a little bit of oral fun over the weekend. We can see.
Wait, what do you mean?
Like
Like if somebody sucked a bunch of dicks or something? No, I don't know.
Yeah.
For real? Wait, what?
Yeah,
Oh,
that one's super fun. Those are fun conversations to
how,
have.
how do you see that?
I don't know if I should tell you. I feel like it should be a dentist secret. No, I'm just kidding. There's it creates like it break the suction. It's like a hickey sort of. The suction will break tiny little blood vessels in the roof of the mouth, and so you'll see little. They're called petechiae, and you'll see little red spots all over the roof of the mouth.
Oh my God.
Isn't that
That is
fun?
the best intel. Holy shit. Wow. Oh my gosh. I'm so glad I asked. I'm wondering too, like, what other habits do you see, like maybe biohackers are doing or something like that, that they're just, putting out there on social media? There's so many now, but are there any other ones like the ACV or whatever that you're like, that could potentially be problematic for?
Damaging. I think some people can overdo the abrasive powders. So I know everybody started, wanting to get away from gross ingredients in your toothpaste, which is great. I agree with that. And they'd switch to these really clean powders. And sometimes, especially like baking soda is a little more coarse and a little grittier even than bentonite clay or activated charcoal. But they all can sometimes be too gritty to use every day. And so sometimes we'll see a little extra etching of the tooth enamel that we just want to be careful of. I usually tell people if they want to do one of the more abrasive powders, just to do it a couple of times a week instead of daily. And
What
that's
do you
usually
use? What do you use? What toothpaste?
I rotate because I'm always wanting to try new things because my
Oh,
patients are always trying weird, crazy, wild things.
what's your favorite? What's one of your favorites?
There's one called David's that I really like. Um, Boca is like a good David's and Boca, I think, are really good at feeling like the old school Crest and Colgate. So they've got a nice feel that you would expect. Um, Risewell is one of my favorites, but it doesn't feel like the old school toothpaste. So it's like you got to reset. Like, okay, it's not supposed to be. It's not Crest.
Mhm.
Uh, but really good flavors, and I just really like their ingredients, and I like their people, and I like their transparency around their ingredients. Like I can call one of the founders and be like, "Hey, what's up with this?" and they'll reply back. So I really like that.
So we didn't really touch on fluoride. I know that you're very particular about having a fluoride-free practice, I believe,
Yeah.
and I'm a little torn personally on fluoride. I know that there's so much controversy and talk about it, and I listened to a podcast called "This Podcast Will Kill You." I love those girls. They're like epidemiologists, and they always, yeah, they're great, and they really study the history and all the things about different diseases. But they did a couple episodes recently on fluoride. And so I listened to those, and there are benefits. I was just surprised, right? You don't want to use too much, and maybe that's a thing, like people have used too much. And anyway, it just left me kind of on the fence, right? And I really didn't feel strongly either way, but I saw some benefits. So
I think that's
how do
good.
you feel about it?
I feel like I will maybe my pendulum might swing back to the middle if we can just, for once and for all, get it out of our freaking water.
Hmm.
That's the issue, is that we're overexposed, especially here in the States. We've been adding it to the water for so long without people's consent. Nobody's consenting. There's
Right,
no
right.
information around it. And you can't control the dose when it's in the water supply. So it really makes me mad. just from an ethical standpoint, I think it's wrong that it's in the water. And I think the newer studies, the newer research are showing, hey, there's maybe more concern and more risk than we once appreciated that there was. They've
Mm-hmm.
already lowered the ideal limit from 1 part per million to 0.7. And there are still people in areas in certain studies where you've got too much fluoride in the blood system, too much fluoride that they're picking up, and that is correlated with a decreased IQ in our kids.
Mm-hmm.
So I think you're right. It's dose dependent, and topical use of fluoride can be effective, and I don't think it would be as big a deal, except that it's everywhere. Because when
Mm-hmm.
it's in your water, it's freaking everywhere. It's in that can of juice that you buy. It's in your sparkling water. If it's in your box of crackers, any kind of manufactured food, if they're using a municipal water supply to manufacture that food, then it's going to have fluoride in it.
Mm-hmm.
So that's really the main issue that I have. I would love to be at a point where I can change my mind. I can
Yeah.
change my mind and not worry about it again. But for right now, I think we're all overexposed.
Yeah. Well, it's a fascinating podcast too, if you want to check it out.
I will.
I was very interested because it is naturally occurring in some water. So,
Right.
do we take that out? So it's really interesting to get more educated on all these things for our own health. What is like your ozone water? I don't really know too much about that. Is that something you use at home too?
I don't use it at home. I know a lot of people that do.
But in your practice,
No,
you
in the
do.
practice we do.
Mhm.
Yeah, we
Yeah.
ozonate all of the water, and it's great at reducing inflammation. It kills
Nice.
bacteria and fungus. It kills all the bad stuff and helps kind of upregulate the immune
Hmm.
response of our healthy cells. So it's really just a great tool that we have access to in the practice.
I love it. Well, so like, say somebody's listening and they're like, I live in wherever. I can't come to you because you're located outside of Dallas. What do they do? Right? If somebody's like listening and going, like, I'm sitting here like, do I have somebody in Austin? Surely there's someone, right? And because I want to do all this. So what do you tell people? What do they do? Or what habits can they at least start adopting now that can really
Yeah.
serve them in this way?
Yeah. So we have a lot of patients that travel. So if it makes sense, then we'd be happy to host you. We'll help get you all set up. And some people will come to us if they just need like big stuff, like they need their root canals looked at or they need their amalgam fillings taken out safely. Then they'll come and stay for a few days, or if they're visiting family, and we can make that happen here in Dallas. But I would encourage everybody, like if it's something that sounds like it'd be a good fit for you, then there's a website, there's a directory on the website, IAOMT.org. And it's the International
Cool.
Academy of Oral Medicine and Toxicology. It's a crazy long name, but IAOMT.org. And they've got a great directory, so you can find a biological dentist, and hopefully there's one close to you or one that's within a reasonable driving distance to you, to find somebody who's like-minded. And you can even find out what certifications have they done, how many meetings have they gone to, so you can kind of get a feel for, are they just playing around with the biological stuff, or are they like really committed, or they're an OG in biological
Yeah.
dentistry. And you can get tons of information there.
That is so cool. I mean, I'm going to put a link in the show notes to that website so people can go check it out. And then habit-wise, I mean, I'm sure people are wondering too, like, what are some of your go-tos that you do every day? Like, do you, like, I'm not a tongue scraper, but I know a lot of people are, or oil pulling, or all these other things that people can do. I mean,
Yeah.
do those matter? Do those make a difference? What do you tell
I
people?
mean, tongue scraping will change your life. You should try it.
Why?
I'm going to send you
It
one.
kind of grosses me out. You are?
Yeah.
Okay, good.
It will
Why?
change your
What?
life.
Really? It'll change my life.
Yes,
Okay.
it will change your life, because it's for one, if there's some stuff coating your tongue, it's going to look really gross and you're going to never not want to do it again. And
Yeah.
it's like, again, this goes back to ancient wisdom. It's an ancient Ayurvedic practice that's
Okay.
been done for thousands of years. It gets a ton of bacteria off that your toothbrush can't get off. There's nothing like it. Life-changing.
Nothing like it. Do you do it once a day, twice a day? What do you do?
Once a day is fine.
In morning or night?
I do it in the morning.
And you brush before or after?
I brush before.
You brush before and then you tongue scrape.
And then I tongue scrape. Yeah.
Okay. That's good to know. Just one time, or do you do it more than once?
Couple of times till I know it's clean.
Really? A couple times? And it's metal? Is it metal?
Mine is metal.
Is yours metal? Okay.
Yeah.
And then, let's see, I have to know like all these things. I want it laid out. Like, tell me exactly what you do. And then oil pulling. I know that like, I think Gwyneth Paltrow swishes oil around in her mouth.
I know. I love it. The patients who do it have good results. I just don't have the patience to do it every day. So yes, it's helpful. I will never discourage anybody. There's some benefit to it, but we've got other tips and tricks and tools, and there's mouthwashes that are, not toxic that you can use instead. So you don't have to do that if you don't want to.
Are there any other habits that like are life-changing that I really need to make sure I'm doing?
I mean, you got to get something in between your teeth. Whether that maybe it's floss, maybe
I'm
it's
a religious
not floss.
flosser. Religious.
If you're a religious flosser, then you're A-okay.
I am.
If there's like a 70-year-old grandpa listening whose fingers can't wrap around the string, then there are other tools that you can use, or a water pick. Like a water pick is a good substitute sometimes. But get something in between your teeth.
Okay. Something in between your teeth. Okay, good. That's pretty basic. That's easy enough.
Easy.
Right? Yeah, easy enough. Okay. Well, what did we miss as we wrap up today, Toni? And you are amazing, can I just say. So what did we miss, or what would you like to leave everyone with before we sign off today?
Well, we missed, I don't know. We'll just have to do a part 2 because I'm sure there's a ton of stuff. We didn't talk about root canals. We didn't talk about mercury. We're just going to have to come back and do it again. So I really just want people to know, and I hope that everyone who listens knows that your body was designed to heal. So all it needs is a little bit of love, a great mindset, and the right tools. So
I love that so much. And I would love to do a part 2 with you and dive into talking about, everything else, root canals and all that. I know we didn't get into that, and I really would like to.
Let's do it.
Yes. Yes, please. We can book it right away if you want to. So yeah, I would love to have a part 2 and talk about all that. So thank you so much for your time today. And please tell everyone how they can find you, follow you, all those things.
Absolutely. You can find our website. The website to my practice is www.flourish.dental. Again, we're just right outside of Dallas on the north side of town. Online, I'm probably the most active on Instagram, and that's just at Dr. Toni Engram on Instagram.
Wonderful. And those will be in the show notes as well. And so now we have a part 2. Is that cool? Is that cool with you? Okay, good. Because I really want to dive into those other things. And I'm very much looking forward to it. So thank you so much, Toni. Dr. Toni, everyone go follow her and, start scraping your tongue, because apparently all our lives are going to change. So thank you so much, Toni. That's a wrap.
Thank you, Amy.
Holy shit. That was amazing. Amazing. I'm so excited that we're going to have a part 2. We are doing it, so stick around for next week, because we are going to have another episode talking about root canals and all of that. So thank you so much for being here today. I just love you so much. And we're rocking our oral health, aren't we? I mean, I guess I got to start tongue scraping. It's always kind of grossed me out, but I guess I'm going to do it. So I'll keep you posted on how that goes. So follow the show, follow on YouTube, sign up for the newsletter if you haven't. It's amyedwards.com.info. It's all there. Big thanks to my hair sponsor. I'm getting new hair I'm getting it redone in just a couple days. I'm pretty excited. Collective ATX, the best hair extensions. Also, big thanks to Skyrock Sedona. If you're interested in going to Sedona, I know I've been talking about it a lot. Check it out. There's a link in the show notes. And to our team, Podcast Magician, the best podcast editors ever. Love them so much. So connect with me if you want to. You can always reply to the newsletter or hit me up on Instagram at Real Amy Edwards. I love you so much. Keep shining bright and get those smiles just shining even brighter. Till next time.
Thank you so much for being here. Please rate, review, and follow us. And we'd love to hear your feedback. Keep shining bright.